Holder Diabetes Center.
The only difference between a glass of orange juice and a glass of Coke is that the orange juice has some vitamin C in it. They both have almost the same amount of sugar.
Cock-a-doodle-doo, says the cop on the wall, as it's 9 o'clock Saturday morning and it's time for 15 diabetic friendly minutes with the compliments of the Barbados Diabetes Foundation. In today's show,
I'm going to start off with a minuscule rant.
You heard Dr. Diane Brathwaite.
I'm going to start off with a minuscule rant.
What does Dr. D have to rant about? Listen to hear more. Also from Dr. D, she again addresses this topic:
diabetes and the feet.
How should you be taking care of your feet? All this and more coming up with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Ice Screening Program, and the bank that can wake you up to make your dreams a reality. Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you.
In 2026, for podiatry, diabetic eye screening, and vascular services, the Maria Holder Diabetes Center is your #1 choice for the best diabetic services at the best price. If you are diabetic or pre-diabetic, or would just like to get your numbers checked, diabetes doctors, nurses, a dietitian, and a range of health professionals are available to serve you. Just call 417-0305 for the Maria Holder Diabetes Center located in Warren St. Michael, saving your life and saving you money. But members get 10% off.
A good Saturday morning, VOBers. It's Peter Boys here. And have you noticed the Maria Holder Diabetes Center located in Warren St. Michael looking very spacious recently?
I noticed. It looking pretty if it's true.
That is because of a brand new paint job. Compliments of Harris Paints, Williams Equipment, Marine Power Solutions, and Lockheed Holdings Inc. So thanks to their generosity, if you're a diabetic or pre-diabetic, the Maria Holder Diabetes Center is your one-stop location for all the diabetic health services you need, and now in a prettier building too, right behind Eunice Gibson Polyclinic. And that is also where you will find diabetes specialist Dr. Diane Brathwaite, aka Dr. D, who wants to rant this morning. You want to hear Dr. D rant? She will also share some important diabetic health information. So, morning Dr. D.
Hello, good day. It's Dr. Brathwaite here, wishing you another happy Saturday morning. I hope you had a good week. We had a good week. We had a very busy week. And I'm just going to start off with obviously giving gratitude to God for sustaining me and my staff and our staff who work so hard, and just gratitude for all the doctors and healthcare providers out there today. So what am I going to talk about today? I'm going to start off with a minuscule rant, and my rant is simply that I want people who are having issues with their feet, if they're living with diabetes, and even more so if they're at higher risk because they have diabetes and they have poorly controlled sugars, or they have nerve dysfunction, or reduced blood flow in their feet, or chronic swelling with their feet, or kidney failure. If you notice something wrong with your feet, please get to your doctor early. Please stop trying to treat problems on your own. Within the last 2 weeks, we have seen some significant infections, and simply because people are not presenting early enough, it's time for us to respect ourselves, respect our bodies, and do better. Please do not try to treat your feet at home, especially if you have complications related to diabetes. A lot of the times it doesn't really work out in your favor, and so sometimes, unfortunately, what we see is that we see people coming with very severe infections with a lot of tissue damage, tissue death, and tissue loss. And even though we want to do the best for you, you've come at too late a stage. I mean, we're all healthcare workers, we're all trained, but We're not Jesus, and we don't have a magic wand. So that's my mini rant. Alfonso, pray for me. It's just that it's very upsetting when I have to see these types of cases.
I can pray for you the other day.
So after my rant, I'm not sure how much Peter's going to edit out. Bleep, bleep, and bloop.
I did not edit you that today.
I hope my managers don't fire me. But I like keeping it real on this show, and I think that's what people appreciate, just keeping it real. So the other thing I want to talk about very quickly is diabetes and the feet. So last week we went into nerve injury in a lot more depth, and I hope I didn't confuse people, but I don't know, I'm just that kind of brain where I like attention to detail basically. But I also think it's important that people understand their bodies, and I hope I can break it down simply for you. We talked about diabetes and the feet and the nerves, and also which nerves are affected and how those different types of nerves are affected. We mentioned several different sets of nerves in the body: the sensory nerves, the motor nerves, the autonomic nerves, etc. But diabetes, think about it, if your blood sugar is not controlled, it's just not as sweet as it is. Diabetes can affect the nerves, but it can also affect the joints, where it causes inflammation and arthritis of the joints, especially the small joints in the hands and the feet. It can also affect the ligaments, where it causes stiffening of the ligaments, which can change how you move. It can also be a significant kind of source of pain, and it can change the integrity of the skin as well. So if you want any take-home message from that, control your diabetes to involve these multiple complications it can cause. So when we do a foot screen, what do? We look at the foot, we inspect the foot, we look at the skin, we look at the color of the skin, we look at whether you have hair on the skin or you don't have hair on the skin. We look at the toes, we look in between the toes for any evidence of fungus. We look at the nails, we look for evidence of nail damage, nail hemorrhage or bleeding under it. The correct term for that is subungual bleeding or subungual hematomas. We look for whether the nails are thickened, whether there's evidence of fungus. We look for whether the skin is extremely dry, extremely sweaty. We also look obviously for certain kind of rashes that can be more common in diabetes. We look for the flexibility in the joints. Remember, we said that the tendons can be affected, and this can make some of the joints quite stiff and having reduced movement, which can affect how you walk. It can affect how much pressure you put onto certain parts of your feet as you walk. We also then look at the circulation. We feel for the pulses in the foot. We check on the top of the foot, and we check behind the bone on the inside of the foot. That's behind what we call the medial malleolus. There are two pulses. The one on the top of the foot is called the dorsalis pedis, and the one behind the ankle is called the posterior tibial. So not only do we check by putting pressure on it, but sometimes if we're able to, we can listen with a handheld Doppler to listen to the quality of the sounds of the blood going down or the quality of the artery flow. We check to see if we have swelling on the feet, whether there's evidence of veins or vein insufficiency. So we look at all of these things. And then of course what's most important is that we look at your feet when you're standing. Do your arches collapse? Do your feet roll inwards? We look at how you walk. That's also very important. And we check your shoes, just as you should be checking your shoes. We check to your shoes to see whether there are areas where there's more pressure being caused by possibly more pressure being placed through the foot. We check to make sure that the shoes are the right types of shoes. Do they have enough cushioning? Do they have enough arch support? Are they the right on the inside, the fabric? Do you have inseams? Do they actually fit you? So these are all the things that you have to think about. I'm not just telling you what we look for. I want you to think about when you look at your feet and when you're walking and when you put on a pair of shoes, what do you think about? And that's really important. We check for the sensation. We use a special tool. It's called a monofilament, and we check in different areas. It's almost like, tell people it's like a thin fishing wire. So you're not going to get pain when we do it, but you just feel a bit of pressure. And we check in multiple areas to see whether you can appreciate the pressure by this monofilament or not. And we also check to see if you can appreciate the sense of vibration. In some cases, we may check to see if you can tell if your joint is in different positions. That's called proprioception. We also look at things like balance. So I've just basically broken down a foot examination for you. There can be more in-depth testing tools, but this is the basic foot examination you should expect to get, or you should ask for if you haven't had it in a while. Everybody should have this in-depth check check at least once a year. And if you have complications related to your foot, there are certain things they may check more frequently than that. We may recommend added tests if necessary. So I've said my piece for Saturday. I want to wish you a beautiful weekend. I hope you learned something from what I said, but I want you to think about all those things when you look at your foot. Check your feet every day. I want you to make sure you check the bottoms of your shoes before you put them on. Make sure nothing is punctured through them that can stick you in the bottom of your foot. I want you to make sure you shake your shoes out before you put them on. We've had cases where people put their shoes on without shaking them out, and there's something like a rock on the inside that can be rubbing that then injures the foot. Remember, if you have callus is not normal. Callus means that you're getting too much pressure in a certain part of the foot, and callus should be managed. Callus shouldn't be left there because it could injure your foot from the inside out. So I've given you some tips, some bits. I've given you a mini rant, and I hope the message will be meaningful to you. Happy Saturday.
Thank you for all that good information, Dr. D. I hope you don't get fired, because we're looking forward to hearing you again next week as we go into our Saturday song of the day. And in case you thought that folk out that I played at the start of the show sounded familiar,
It'll sound familiar for true.
that is because it's the intro to this vintage Kaiso. So if you like chicken, you will like this one. This is the Mighty Gabby with Chicken and Ram. Compliments the Maria Holder Diabetes Center and Republic Bank. If you're cooking chicken, make sure you don't put it on salt.
My name is Rani. Don't mistake me for Granny. I have great authority in the ministry. I am a fella, as healthy as ever. Still they blaming me for the chicken catastrophe. Chicken and ram, chicken and ram. I don't give a damn. I love my chicken and ram. Chicken and ram, chicken and ram. All the rest could scram. Give me chicken and ram.
If you notice something wrong with your feet, please go to your doctor early.
Don't give a damn. I love my chicken and ram.
The Maria Holder Diabetes Center.
We now go to a lady who has experienced the Barbados eye screening program.
Well, I found the service is very good, and I would advise anyone who is diabetic, give it a try because it definitely do work. Once you follow the plan and you follow what you're supposed to do, yes, it can improve your eyesight, and yes, it do work. But they didn't only just stop there. I had a nutritionist that taught me the right way to eat, and there was a chart that was given for me to follow, so I wouldn't get off track or go astray and do my own thing.
Cutting edge international medical services are waiting for you at the Maria Holder Diabetes Center. If you are listening to VOB right now and you are diabetic or pre-diabetic, vascular screening, diabetic eye screening, dietitian consultation, and podiatry services can all be accessed by calling 417-0305. Make that call today. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and Republic Bank. Until next time.
Remember, diabetes isn't just about sugar. It affects your heart, kidneys, eyes, and mind.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $100. Or members get 10% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you.
The Maria Holder Diabetes Center.